Hello, everyone. Thank you for joining us today in our webinar. We will begin with a short introduction on Shifa Community Clinic and our guest speaker for today.
Hello, everyone, and welcome to Shifa Community Clinic's outreach webinar. Today's topic is diabetes and hypertension. For those of you who do not know, Shifa Community Clinic is one of UC Davis's 7 student-run clinics that provides health insurance to the underserved and uninsured population of Sacramento. Shifa has recently opened up its own COVID-19 vaccination clinic site, and so we are offering both Moderna and the Johnson & Johnson vaccine. We provide vaccines every Saturday and Sunday of the week. And we are open for vaccine appointments from 9 a.m. to 5 p.m. If you qualify to receive the vaccine and would like more information or would like to schedule an appointment, please visit our website at shifaclinic.org or call us at 916-573-6941, or you can email us at vaccine.shifaclinic@gmail.com. Our guest speaker joining us today is Dr. Ajay Sood. Dr. Sood is a clinical professor in the Division of Endocrinology Department of Medicine at UC Davis and is the section chief of endocrinology at Sacramento VA Medical Center. He provides care for patients with all kinds of endocrine disorders such as diabetes mellitus, thyroid diseases, and pituitary diseases. His research interests have included looking at the effects of diabetes medication on cardiovascular diseases in diabetic patients and the use of telemedicine for the management of patients with diabetes mellitus. So Dr. Sood can go ahead and begin his presentation now.
Thank you, Amanda.
Thank you. Good morning, everybody. First of all, I would like to thank Shifa Clinic and Amal for inviting me and giving me this opportunity to talk. I would be discussing topic of diabetes. It would be a general kind of a discussion. I have no conflicts of interest, and I do want to kind of highlight that this is about general knowledge related to diabetes mellitus, and individual people should not make changes to their treatment without consulting their physicians or healthcare providers. It's very important that you discuss it with healthcare providers before you make changes. So first question we should ask ourselves is, why should we know about diabetes mellitus? One, it is common. Second, it's a serious condition, and knowing about it can make a difference. So let's look at all these points. How common is diabetes mellitus? So these are data from CDC, Center for Disease Control and Prevention, from Atlanta, Georgia. And if we look at our total population in our country, 10.5% of the population has diabetes mellitus. If you just look at adults older than 18, 13%. And that really means 1 in 8 person is diabetic. If you look at adults more than 65 years of age, nearly 1/4 of adults 65 years of age are diabetic. The prevalence of diabetes mellitus does vary among different ethnic population. As you can see, Hispanics and American Indians have a very high prevalence. Asians have high prevalence too, and that's 9.2%. Specifically, if you talk about South Asians, the prevalence is up to 12.6%. So among Asians also, there is a difference between different groups. They're not very homogeneous. But there is a group of people where, or individuals where the diagnosis of diabetes is actually not made in the first place. And there are about 7.3 million people in the United States where they have diabetes, but they don't know. And how do we know about this? We know about this because when we do surveillance of the population and test everybody and asked people whether you have diabetes or not, we find that there are some people who said they don't have diabetes, but on the test they were found to have diabetes mellitus. Is undiagnosed diabetes harmful? Yes, it is, because it will cause all the same complications that anybody with diabetes would have. So it's very important to find out and identify these people who don't know they have diabetes and should be diagnosed. This is kind of highlight what's happened in our society. And this figure is again taken from CDC Atlanta website. And if you see the 3 years, this is state-wise prevalence of obesity and diabetes from 1994, 2000, and 2015. And darker the state is, there is more prevalence of obesity. And darker the state is in the lower part, there is more prevalence of diabetes mellitus. So if you would see, if it's darkest up here, more than 6% of population is obese, and we're talking of adult population. And if it's darker than darkest here, it is more than 30% of population has diabetes. So the prevalence of diabetes is really high. But who is likely? I do want to kind of stress this point that as obesity increased and physical inactivity increased, the prevalence of diabetes has gone up. Who's more likely to get diabetes? So what are the risk factors? Who should be more concerned? Individuals who have family history of diabetes mellitus, individuals who are overweight, individuals who have low amount of physical activity, individuals on certain kind of medications should be concerned. Certain ethnicity, as I pointed out, Hispanics, American Indians, and Asians would have high prevalence. African Americans have higher prevalence than the Caucasians. And individuals who have high blood pressure, high cholesterol, heart disease, or stroke should also be concerned. Their risk of having diabetes is higher. So these individuals actually should get screening on a regular basis. How do we know whether an individual is on overweight or not? And on the right, you would see these kind of charts. You can easily find it on the internet. But what this is showing is something called body mass index. And the normal body mass index is considered anything from 19 to up to 25. If you're 25 and over, you're considered overweight. The body mass index is a calculation done on your height and weight. So we're looking at the weight, but we are accounting for a height. So if you are tall, then to be overweight, you have to have a higher weight. And this graph kind of shows that. So if you're in green here, which means your body mass index is between 19 to 24, you are fine. So if you are 5'11", and then your body weight can be anywhere from 140 here to 170, then you should be fine. If you're exceeding that and you're reaching weight of 180, you're overweight now. And what different colors are different gradations of being overweight. And if you are more than 30 or more, technically we call that person obese. And if you are 40 and more, then we call it extreme obesity or severely obese. We do need to remember there are some ethnic differences, and in Asians, a lot of people consider normal body mass index to be up to 23 instead of 25, because we've seen that in Asian group, and this includes both South Asian and East Asians, these people tend to get same problems with diabetes and hypertension at a lower weight. So the cutoffs for body mass index, what is normal or what is normal weight, is lower in this group of individuals. So how do we figure out if somebody has diabetes? The first thing is we talk about symptoms. What are the symptoms? But important thing to remember is a lot of times there are no symptoms. So you go to a routine physical exam, or you're being checked for something else, and a blood test is checked, and the blood glucose values are high, and the healthcare provider tells you you have diabetes. Sometimes we have to do a second test to confirm it, but there are a lot of times you may have no symptoms. But if you do have symptoms, the common symptoms can be just tiredness or fatigue, excessive urination because you're spilling your glucose into the urine. So it draws water with it and you have excessive urination. And because you're spilling all that urine out, you are very thirsty. There is increased appetite because you're losing all those glucose calories into your urine. So your appetite goes up, but you're losing weight. So these are, if you're very hungry, but you're losing weight at the same time and you're eating more, one of the diagnoses you should think of is, do I have diabetes? And then recent changes in vision, if somebody has that, should be screened for diabetes. So these are some of the common symptoms for diabetes. And if anybody has that, blood glucose value should be checked. But there's something also called as borderline diabetes or pre-diabetes, and it's important to know that also. So when do we call somebody as borderline diabetes? When your blood glucose is more than normal, but it's not as high to go into the range of diabetes, then we call that individual pre-diabetes or borderline diabetes. For example, fasting blood glucose normally in a normal individual should be 99 or below. So if you're more than 99, but you are less than 126, because at 126 you become diabetes. So anywhere between 100 to 125, you would say that this is borderline diabetes. And there are some other cutoffs for after meal numbers also, and I will show you that. But this is what borderline diabetes means. And why is it important to know that individual has pre-diabetes or borderline diabetes? Because some individuals with pre-diabetes can also get all the complications what people with diabetes can get. And if you, at this stage, make changes to your diet and physical activity, you can reverse this process or halt this process and not go to have diabetes. So it's important to kind of know at that time and maybe make changes to your diet and exercise and lifestyle. I did put in some figures here, numbers to kind of say what is diabetes, what is borderline diabetes, and what is normal. And so we kind of look at three numbers. We look at fasting blood glucose, we look at glucose 2 hours after meal, or we can look at something called A1C. And A1C is a blood test which indicates what your average blood glucose has been for last 3 months. It's expressed as percentage. So all these numbers have cutoffs where if your fasting is more than 126, or after meals it's more than 200, or if your A1C is 6.5 or more, you have diabetes. The normals are 99, 139, and 5.6. And if you're somewhere in between these numbers, we call that person a borderline diabetes. So I told you how prevalent it is. How do we identify? Now we're going to talk about, is it serious condition? And why do we call it a serious condition? Because individuals who have diabetes have increased risk of heart attacks, heart failure, stroke, poor circulations in legs. They're more likely to get amputations of their legs or feet as opposed to people who don't have diabetes. And we're talking of non-traumatic amputations, which are not caused by accident or something. There are effects on nerves causing abnormal sensation and pains in legs and arms, increased risk of kidney failure, increased risk of poor eyesight or loss of eyesight actually, stomach upset, low blood glucose while you're on treatment is a very very problematic condition for people who have diabetes, and even early death in people who have diabetes. So it's a serious condition and we need to take care of this. And we know that if we take care of this in a more effective way, we can decrease all these risks. Often people ask, is my diabetes severe? Well, all diabetes is severe and serious. But we can kind of say whether your diabetes is controlled or uncontrolled. And we say that based on two things. We say that based on the blood glucose levels and the A1C test I talked about, which indicates average glucose values for last 3 months or so. So the next question I asked is, how do we check glucose? So it can be checked in the lab. You go to a lab, they draw blood, but that's not how we often check in people with diabetes. To make a diagnosis of diabetes, we'll do that. But once you have diabetes, that's not how we go. We provide patients glucometers, and these glucometers with the test strips, you stick your finger and you get a reading in the meter. you require very little blood. These are quick and efficient, and they're very accurate. So generally within 10 to 15% of the actual value, they will give you a reading, which is good enough for taking decisions of what to do or what not to do. But there is also something called as continuous blood glucose monitor, and you would have seen more and more people talking about this. It's a great advance. What it is, there's a small plastic tubing under the skin. So you have a sticker-like thing, and there's a small plastic tubing which goes under the skin, and it measures glucose every few minutes and gives you a reading into a receiver. Or if you have a smartphone, you can get the reading into the smartphone. You can draw graphs, and you can chart your values. It can give you alarms for very high or very low blood glucose values. So if you are dropping and you're going to have a low, it will tell you that your blood sugar value is going low. There are different kinds of these meters in the market, these monitors in the market. And at least in United States right now, there are 3 different kinds available. And usually once you apply it on the skin, these would last anywhere from 10 to 14 days, and then you have to change it every 10 to 14 days. Who are the individuals who would benefit from continuous blood glucose monitor? Not everybody is likely to benefit from it, but some individuals are likely to benefit more. Individuals who are in insulin treatment, individuals whose blood glucose really fluctuate a lot. Sometimes it's very high, sometimes it's very low. People who get frequent low blood glucose, and that we are not able to correct with adjustment of medication. So somebody who get low, we can lower the dose and it becomes all right. Really, you don't need a continuous blood glucose monitor. But there are individuals where we keep adjusting the medication, they still keep getting low, and those are the people who would benefit. And then if certain occupations where if you get a low blood glucose, it's going to be very harmful. As somebody working with heavy machinery, somebody who's climbing poles, electricians, carpenters, sometimes working with sharp tools, so those are the people you don't want them to have low blood glucose at all. And some individuals who are not able to check blood glucose with a glucometer. For example, if they have deformity of the hand, they're not able to manipulate the meter or the strips, this would be a useful tool. Now, so insurance companies may not provide this to all patients who ask for it. And there are times when individuals ask for it, we want this, and every insurance company have their own set of guidelines when they're going to provide this, because they tend to be more expensive compared to the usual meter test strips. So insurance companies may have their own criteria of who would get it and who would not. I can tell you that most of the individuals who needed it and got it, it made a huge difference to their lives. So we want to talk a little bit about, so we talked about how we monitor diabetes. How do we come to know whether it's, how do we monitor diabetes? And we'll talk about how it is well controlled or not. But we're going to talk about what are basic types of treatment for diabetes. And again, as I pointed out, I'm not going to be discussing individual treatment in details. We're going to just stick with some principles here. And whenever we talk about diabetes, we always talk about diet changes as among the first one up there, because that really can make a huge difference to the outcomes. We talk about increasing physical activity, and then lots and lots of education, because you really need to understand what this is all about, what you can do, how to monitor. Unless somebody who has diabetes don't know this, it's very hard to achieve results. And who does the education? It can be a healthcare provider. In addition, there are individuals called diabetes educator, and these can be nurse, can be a dietitian or a clinical pharmacist who would take classes or who can sit individually with you. There are group classes, there are individual classes, and talk about various issues related to diabetes. Some of the basic information on treatment, and again, I would not go into each, and I'm not going to go into different medications we use, but there are tablets. There are many kinds of tablets. There are some tablets which are useful in people with certain kind of conditions. Injections, which are not insulin, are also available, and these are every day or once a week. Then there are different kinds of insulin. Now, many kinds of insulin are available. There are different kinds depending on how fast these insulin acts. There are short-acting insulin, there are long-acting insulin. But anybody who's on insulin need to know how to store insulin. That's really important. Learning how to correctly inject insulin is very important. And often this is a huge mistake, which some individuals do is they've not learned how to inject properly. So if you're not injecting properly, it's not getting into your system. It's not producing the required effect. So you really need to sit down with the educator and learn how to inject it properly. And some insulins really have to be timed with the meal. So some have to be taken, 5 minutes before the meal. Some have to be taken half an hour before the meal. Sometimes in certain conditions, you can take it right after the meal. So that all that is important. And there's something called insulin pump. Now, insulin pump delivers insulin like every 5 minutes or every few minutes into your system. But it's not something which you put on yourself and forget about diabetes. You still have to work with it. You have to enter readings into it, your blood glucose reading, how much you're eating. And there are different kinds of insulin pumps available. So insulin pump is not appropriate for everybody, but it is appropriate for a few people with diabetes. And then regular medical checkup and taking all your medications is really, really important. You may be prescribed medications, but things change in our life. Sometimes, control is good. Sometimes control is not bad. You get sick. You are more active, you're less active, you gain weight, you lose weight. So medications have to be adjusted. And therefore, a regular medical checkup, which also, require regular labs, so you get feedback on what's happening, is really, really important. Usually this regular medical checkup would range from anywhere from 3 to 4 months on the usual to up to 6 months if you're doing really, really well. But I didn't talk about specific medications. What I do want to tell you that every medication is not good for everybody. And we use some factors to decide which medication is going to be best for you. So here's a general thinking. How high is your blood glucose? Because some medications would drop the blood glucose more than the other. What is your age? We tend to use not use some medications in older people or younger people sometimes, depending on what your condition is. What is your weight? Some medication leads to more weight loss. Some medication lead to less weight loss. So we need to kind of look at that. What is your profession or work schedule? Because we have to adjust the type of insulin, for example, you're taking based on what your schedule is like, whether you're night shift worker, whether you're morning, daytime worker, whether there's your profession is something where you can't risk having hypoglycemia or low blood sugar, or you're in a profession where your employer does not let you to take certain kind of medications. For example, pilots are not allowed to fly if they're on insulin. So we have to use other alternative medications. And then do you have a heart disease? Because some medications are beneficial for people who have heart disease. And similarly, if you have kidney disease, because some medications are beneficial for people who have underlying kidney disease. And do you get low blood sugar frequently? Because some medicine produce low blood glucose more often than other medications. Some medications don't produce low blood glucose. So we take all these factors into account to figure out what's the best medication which would work for you. So the next step is to figure out, is my diabetes controlled or not? And as I mentioned before, we look at both blood glucose and A1C test, which is what tells us your average control over the last 3 months, and both are important. What is a good control for an individual? It has to be decided by the physician or healthcare provider. What are your cutoffs for the good control? Because cutoffs for somebody who is 25-year-old and has diabetes are entirely different from cutoff for somebody who's 70-year-old has diabetes. Cutoffs are different if you have 70 years old and have a heart disease. Cutoffs are different if you have 60 years old and have kidney disease. So we individualize those cutoffs for individual. So younger persons are more likely to have lower blood glucose and A1C cutoffs as compared to the older individuals. I just put up one of the examples so that to give you a general kind of an idea of where it should be. So in majority of older individuals, for good control, we're looking at fasting or before meal blood glucose values of 80 to 130, 2 hours after meal less than 200, A1C between 7 and 8, and avoiding low blood glucose values less than 70. Now, as I said, these cutoffs would be very different for different individuals. Younger people, they would be lower. For younger people, the A1C would be less than 7. And somebody who is even older and have other medical conditions, A1C could be higher. It could be even more than 8. So we have different cutoffs for different individuals. But do remember that if your A1C is more than 9, there's a very likelihood that your diabetes is not well controlled. So blood glucose is not the only thing when we take care of people with diabetes. There are other things, and they are actually as important as blood glucose. As I told you, a lot of people with diabetes can have high blood pressure. So controlling blood pressure is important. A lot of people with diabetes do have high cholesterol numbers. So controlling or improving blood cholesterol is important, and blood lipids. Normalizing or trying to normalize body weight is really important. Increasing physical activity as medically permissible, because you need to know what is allowed medically for you to do in terms of physical activity. So increasing physical activity as medically permissible is important. Stopping smoking is really important. Limiting alcohol consumption is important. So smoking and alcohol would have even worse effects on you if you have, in addition, have diabetes. Taking special care of feet, because as I told you, a lot of people with diabetes end up having problem with the feet, and some of them end up having amputations. So really taking special care of feet. We tell people with diabetes to take care of your feet as you're taking care of your face. And that is really, really important. Getting yearly eye examination, because you can get changes in your eyes without getting symptoms. And if you pick them early, you can kind of, take care of it and prevent them from progressing. And getting yearly screening for kidney disease, which your healthcare provider would do. So diabetes is not just about glucose and blood glucose. It is about all these different things which need to be taken care of at the same time if you want to achieve best outcome. Now I'm going to talk a little bit about how to prevent diabetes, because I think if we can prevent something, then that's really, really good. And we have a very good evidence from number of studies which show that diabetes can be prevented. So one of the program which we talk about is diabetes prevention program. We have now very, very long-term follow-up, more than 20 years of follow-up in this group. This study was conducted by National Institute of Health in United States. And if you have a weight loss of at least 7% and diet changes and increased physical activity, and we're talking of at least 150 minutes per week of physically active. And remember, not everybody may be medically fit to do this, but if you can achieve that, then it prevented a fair number of people from getting diabetes. And 150, to put it in perspective, 150 minutes per week is half an hour every day for at least 5 days a week. And in fact, in this study, they also gave a medication to prevent diabetes, and they found that diet and exercise was actually better in preventing diabetes than medication. And in some of these studies, patients have been followed up to 30 years in a study in China, and they saw the effect of diet and exercise lasting even after 30 years. They could see the effect in that group of people who did intensive diet and exercise intervention 30 years ago. And many insurances actually cover this program and cover the visits to the dietitian and to the providers who are providing this program. So you should inquire about it. Just a few general points. What is a good diet to prevent diabetes? Now, do remember, when we talk about diabetes, concepts of what is good diet keep changing. And as new research comes, things change. So if you read something 10 years ago, it may not be true today because the research has changed. So currently it is believed something called Mediterranean diet is considered the better diet. Basically, this diet consists of emphasis on vegetables and fruits, legumes, nuts, olive oil in moderation. Some people say actually unlimited olive oil. I would probably not agree with it. Limit red meat consumption and limit consumption of sugars, saturated fat, and sodium, which is salt. So if you follow this kind of a pattern of diet, that is considered nowadays, basically it's a more emphasis on a plant-based diet with no red meat and like more emphasis on legumes. Legumes are things like beans would be part of the legumes, or lentils. And then intermittent fasting may be good for prevention. Remember, there's a lot of talk about intermittent fasting. Intermittent fasting is either it can be different kinds. You can fast 1 day in a week, you can fast 2 days in a week, like every Tuesday or Friday. Or you can decide that all my food I'm going to consume in a day is going to be within this 8-hour period. I'm not going to eat for 16 hours in a day. And there are different kinds of intermittent fasting. But remember, individuals with diabetes need to be very careful because this may cause low blood glucose. So you really need to discuss it with the provider before you, as a person with diabetes, you want to do intermittent fasting. But some people have talked about weight loss and prevention of diabetes as good outcomes of intermittent fasting. Who in the family should diet? And this is a question, some people come to us and they want to make changes to the diet, and there are 4 members in the family. One person cannot make a change in the diet in the family. Everybody in the family needs to change. And why? Because healthy diet is good for everybody. So not only it's going to help the individual, but it's going to help everybody else. And if there is a person with the diabetes in the family, there's a high risk that other members in the family, especially who are genetically related, are likely to have high risk for diabetes. So I think healthy diet and making a change in the family as a whole, I believe, is the best strategy to use. We're going to talk a little bit about physical activity. So December 2018, actually, the new national guidelines on physical activity came out, and they actually talked about more physical activity for adults. There are some guidelines for children. I didn't put it there. But as opposed to previously, which used to be 150 minutes per week, now it's 150 to 300 minutes per week of moderate physical activity. If you're doing vigorous activity, then it can be half of that. So 75 to 150 minutes per week. And remember, 30 minutes per week means an hour of 300 minutes per week means hour of activity at least 5 days a week. You can combine these two, moderate and vigorous, and accordingly pick up those ratios. In addition to the aerobic activity, they recommend that every individual should do at least twice a week muscle strengthening activities. In older individuals who may not be able to do this, they talk about doing multi-component activities, which includes balance training, aerobic, and muscle strengthening. So Tai Chi would be a good example for that. Yoga would be one of the good examples for that. And my last slide. So we talked about individual level, what you can do, but I'm also going to touch base here at the community level. And there are issues because certain communities are affected more with diabetes compared to other, and there are issues which are specific to certain community groups. So availability of healthy food in the community, in your surroundings where you live, is an important issue. And there have been studies done showing certain ethnic groups don't have access to healthy food. There is something called food insecurity. So we, as a society, we need to kind of tackle that. And it's been shown food insecurity means person is not sure when they're going to get the next meal and whether they're going to get the next meal at all or not. And actually, these people who have food insecurity tend to eat unhealthy food and tend to probably eat food in larger quantity at one point of time and have more problems in terms of bad effects of eating unhealthy food. Concepts like community garden, which encourage using gardens to get healthy food from the garden for the community, is an important thing. Looking at school meals and making sure school meals are healthy. And there are some communities which have instituted so-called sugar tax, where some sugar beverages are taxed, and studies have shown improvement in changes in the weight at the community level in certain instances. Availability of diet counseling for individuals is important. Availability of affordable and safe places for physical activity. Certain communities may not have access to do enough physical activity or do it safely, and that's important. Subsidizing gym membership would be other issues. And there are actually federal programs which subsidize this kind of membership, for example, in YMCA, to increase physical activity and probably lead to healthy community. So I'm going to stop here. Thank you for listening to me and wishing you all a very good health. And I would be open to questions.
Thank you very much for this very informative presentation and for being here today with us to help us spread awareness. And now we will be able to take questions and comments. So the first question we have is, are there natural-based ways of medication or treatment?
Yes, the answer to that is yes. There are certain natural products which improve glucose values if you're talking of improving glucose. But do remember these natural products have small effects compared to a lot of other medications. And most of time they work in the early stage of diabetes only, or they might work in pre-diabetes stage. So some of the natural products which have been studied are cinnamon, fenugreek, uh, and certain bark of certain trees, bitter gourd. These and so some of these natural products have been studied and shown to have beneficial effect. But somebody who's had diabetes for many years, somebody who's on insulin, which means it is not early stage of diabetes, it is unlikely that these products would be of any use or they would be of minimal use.
Okay, thank you for answering that question. We have another question. When it comes to expertise, what does it mean to be moderate and intensive?
In terms of diet or physical activity, and that's probably the question because I talked about.
Yes, in terms of exercise.
So exercise is actually measured in something called METs, which is amount of physical energy you use while you in 1 hour. So if you are just sitting and it's considered you're using 1 MET of energy. So if you would go on internet and see, I believe if you were more than 3 to 5 METs, it's considered vigorous activity. So you can go on internet and look up which activities would classify as more than 5 METs, and those would be vigorous activity.
Okay, and the next question we have is, particularly the section on the Mediterranean diet, you said that you believe to have a limit in olive oil consumption. Could you expand on why?
So I put in my personal little bias there into this actually because any oil or is fat, and fat has a high calorie content compared to carbohydrates and proteins. So so if you are having unlimited amount of oil, there is a probability your caloric intake would go up. And if you are especially looking for weight loss, then that's not what you want to do. So there are studies where they have used unlimited olive oil in a Mediterranean diet and have shown good results. But I think as a general, I would say in general, if you increase your calories, it would be hard to lose weight. So I would be careful in having unlimited any oil consumption actually.
And then we also have another question about diet. When you say to limit red meat consumption, is this on a daily basis or on a per meal basis?
It's overall red meat consumption. Ideally, it's best not to have red meat consumption at all. And so if you are eating some kind of a non-vegetarian food, it is best to limit yourself to chicken and fish. So overall red meat consumption is what needs to be limited. Is there something which is allowed? There is no specific thing which says this is what is allowed.
Okay, thank you. The next
So I do also want to kind of go back and clarify the cutoff for vigorous activity is 6 minutes, not 5. And anything between 3 and 6 is moderate. Anything more than 6 is vigorous.
Okay, we have another question about diet. Would you recommend the keto diet for patients with prediabetes or diabetes?
So for diabetes, people with diabetes, one needs to be really careful when you're doing keto diets, especially if you are on insulin. And there are we didn't go into different kinds of diabetes. And if somebody has type 1 diabetes, then one needs to be even extra careful if you're going into keto diet. So it has to be really done under supervision. For people who don't have diabetes, it's still best to do it under supervision, especially if there can be extreme of keto diet, there can be mild keto diet, depending upon how much restriction you're doing. And when you're doing extreme restrictions, then really it has to be done under medical supervision, because it can cause some changes in the blood, which really need to be monitored, which can have adverse effects. So in general, I discourage patients of diabetes to go into keto diet or do keto diet. There being shown some benefits. It's an evolving medical field at this point of time. And I think we'll have to wait for probably another 4 or 5 years to get more data on this. It has become kind of a trendy to do keto diet, but it should be done under supervision and definitely with a lot of caution if you have diabetes.
Okay, thank you for answering those questions. Let me see if there are any more. So it looks like those are all the questions that we had for today. Or actually, we might have one more. Yes, so we have one more question. For individuals that have developed type 2 diabetes without the normally associated risk factors, such as weight or diet, what could be other reasons for developing it?
So I'm going to actually rephrase that question. So instead of saying for individuals who develop type 2 diabetes without risk factors, I'll say for individuals who develop diabetes without the risk factor I listed. So I would want to say that, diabetes itself is a very, very heterogeneous condition. There are different kinds of diabetes. The most common in adult is one which we see associated with overweight and lack of physical activity. But there are other kinds of diabetes, things where there are some diseases of pancreas, or you may have some kind of immune phenomena called autoimmune diseases where your pancreas may be affected. Tends to occur in younger people most of the time. It can occur in teens also, but can occur in older people. So there are sometimes when individuals don't have those risk factors which I listed, which are ones for the common variant garden type variety of diabetes. So when that happens, then individuals don't have risk factor and they do develop diabetes. We start looking as healthcare providers, as physicians, we start looking at, could there be another cause for diabetes here? And there are times when we find, sometimes we don't find a cause. And does it help? Yes, if we know the cause, sometimes we can improve things knowing the cause, or the way we treat may be different if we know there is a different cause for it. I also want to say that there is actually a national level study going on where individuals who develop diabetes and have no risk factors or don't present in the usual way are then investigated further sometimes and become part of that group, where there are some genetic tests being done um, and looking for some gene changes or changes in how insulin is secreted to find out more about newer kinds of diabetes. So yes, uh, there are our garden type of diabetes mellitus is one which associated with these risk factors, but there are other kind of diabetes which are not associated with risk factors, and those may be because of other causes, or sometimes we don't know a cause.
Okay, and it looks like we have another question. If someone has had diabetes for dozens of years, then eventually worked to reach healthy glucose levels, should they still be receiving checkups for diabetic complications?
Absolutely. Uh, your risk, if you've achieved a healthy glucose control, your risk decreases. It doesn't go down to zero. So if you have a good control of diabetes, you decrease your risk by up to 60% of getting complications, but there is still a small risk. And so getting regular checkup to look for complications is still important, because you pick those up, you can reverse it. For example, if you have pick up early changes in eyes, you can do treatment to prevent it from worsening. If you pick up early changes in kidneys by doing a regular urine test, you can take medications to halt the further progression. So, and similarly, if you pick up changes in the feet, you can do things so that it doesn't worsen and you don't develop ulcers or have more serious problems. So yes, even people with good control should have regular um, screening for complications.
Okay, thank you so much for answering all those questions. It looks like those were all the questions we had for today. And if anyone has any more, please feel free to email us. So then I just want to thank you again to our guest speaker, Dr. Sood, for taking the time to be here today and to talk to everyone. And now we will finish off this webinar by providing you with resources to help yourself and others.
Thank you for letting me speak to everybody.
Hello, excuse me. So hello, we have a few resources that you can hopefully help you in your journey with educating yourself with the diabetes. So the American Diabetes Association has a variety of different sources and information to obtain from. So they have descriptions on the different types of diabetes, such as type 1, type 2, and gestational diabetes. They provide resources for those struggling to pay for insulin and other medications. The website you can visit is insulinhelp.org. They also have recipes and fitness tips to help maintain a healthy lifestyle. And they even have a short type 2 diabetes risk, which you can find by typing in diabetes.org/diabetes-risk. However, it is important to contact your doctor to get accurate information on your health risks. There's also a portion where they help you understand the different options and medication and treatments for diabetes. And lastly, they also have they can also connect you with a diabetes education program that is near you. And so in order to maintain a healthy lifestyle, we need access to healthy foods. And so CalFresh provides assistance for those financially unable to buy weekly groceries. They provide food stamps that are accepted in almost every grocery store. And you can apply online through mybenefitscalwin.org, or you can call the Sacramento County Department of Human Assistance at these numbers: 916-874-3100, 209-744-0499. And so in order to create healthy food options with those vegetables and the fruits, we need healthy recipes. And so Diabetes Food Hub has a lot of delicious and nutritious recipe options to pick from. They provide information on calories, proteins, fat per serving size in order to track your consumption of these and be able to adjust accordingly. And lastly, we have One Community Health, which is a hypertension and high blood pressure management in Sacramento. They have doctors who specialize in hypertension treatment, regardless of the ability to pay. Their website is onecommunityhealth.com. But if you want the specific website, here is the whole website located. For hypertension, their phone number is 916-443-3299. And so we have created infographics that shed information on diabetes and hypertension. The infographics we are presenting to you today are information on prevention of diabetes and hypertension, more information on diabetes and its risk factors, as well as further information on hypertension and its risk factors you can find at our website, shifaclinic.org. So you can find all of our infographics and the sources of our website at Shifa Clinic. So you go to shifaclinic.org, you click on webinars, and you can look for all our sources by all the links that are provided. So here we have our diabetes infographic.
Thank you so much, Alejandra, and thank you, Dr. Sood, again for joining us in this webinar and for taking the time to provide this information to our patient population and our community. I would like to wrap up this webinar by once again drawing your attention to our vaccination clinic information. At the very front page of our website, you can find the multiple links that you can click to try to schedule an appointment in order to receive your vaccine. It will bring you to this page and you can find where we may have available appointment time slots for you. You can also see here a few more details on the information as to who is eligible for receiving the vaccine as of now and who you can contact in case you have any questions. Thank you all for your time and joining us in our webinar today. And please join us again next week at 11 a.m. for our webinar on COVID-19 vaccine and more information about that in case you're curious about the risks and benefits of this vaccine. Thank you everyone for joining.